Greetings to everyone. Thank you for your attention. I will be discussing themes from program experiences managing communication during the Ebola epidemic in Sierra Leone and Guinea, and the ongoing work with COVID-19 Rumour management conducted by the Hopkins University Centre for Communication Programs. I will start with program challenges from misinformation in a public health emergency, and then discuss what we know about how to counter misinformation in a pandemic. Challenges stemming from misinformation about public health interventions are much more complex than can be expressed in a rapid session. However, there are some general findings distilled from our work that are relevant to other community-based health programs. First, misinformation undermines trust. The panic and fear that characterize infectious disease outbreaks can reveal lurking fissures in public trust when existing communication issues are amplified. Lack of trust creates barriers and negatively affects the relationship between program implementers and beneficiaries, including the uptake of health services. During pandemics, the health system and health workers also experience similar anxieties as the general population that also create barriers with the communities they serve. Misinformation hampers ability to make informed choices about preventive behaviors, in turn influencing poor cooperation and non-compliance with public health directives among community members. Misinformation also may increase ineffective and harmful behaviors, including an increase in risk-taking. And when it targets specific groups or activities, can lead to stigma and violence. There also is increased likelihood that communities will globalize issues related to the specific crisis and extend their negative perceptions and misgivings to other government work and to future pandemics. Communication before and during public health emergencies, therefore, has a key role in establishing strong relationships and trust between caregivers, programs, and those receiving services. So what have we learned about managing misinformation and rumors during pandemics to build resilient communities with some immunity to misinformation? First, it is important to act quickly and put out the fire fast. Short turnaround time requires that programs should be prepared and have a plan in place to manage misinformation. A quick response minimizes the scale of the spread of misinformation and prevents the spread of variations of misinformation that tend to evolve with time. It also is easier to identify the source of information earlier rather than later, and rapid response also helps to mitigate potential severe consequences. Formative work may be necessary for discovering misinformation. Depending on the misinformation and scale of the problem, this could be a rapid or a more formal research activity. Trust is an important construct that affects almost every aspect of health-related interactions and needs to be understood in the local context. How trust is defined traditionally varies and can be a difficult construct to understand. Trust has been defined as ability to meet health needs, honesty, communication, competence, fairness, confidentiality, provider agency, quality of relationships, and meeting expectations. In Burkina Faso, in the Mori language, trust is translated as, I give myself to you. In Sierra Leone, it is defined as, I believe in you. In Guinea, Qualitative research we did show that salient trust constructs included competence, hospitality at the facility, compassion of providers, honesty of health workers, and confidence. So this is a construct that you have to explore in your local context and understand how misinformation affects trust. Formative work is also necessary to understand the context of the misinformation, specifically how it spreads, who it targets, and how it impacts the community. It is also important to know how communities prefer to receive health information, who is considered a credible source of information for a specific public health issue. Preferred and credible sources are not necessarily the same, but the ideal is when they are. Communities themselves can be effective weapons against misinformation. It is the norm to engage communities in program delivery, but it is not the norm to routinely include communities in strategies to prevent misinformation about program interventions. Listening to and in communities is an important first step. Building on existing and trusted relationships and using these networks to listen is a quick approach for hearing how a community feels about a particular issue. Use your frontline health workers, your household visitors, your volunteers. This allows early recognition of misperception about a program. A program's response to misinformation is more than simply putting out correct information. The response often extends beyond the geographic boundaries of the program. Different groups within communities respond differently to the same misinformation, so one must accurately identify the key audience that needs to receive correct information, or the different needs of subgroups within the population. With training and resources, community members make credible, influential spokespeople to counter misinformation and to rally the larger community towards the truth. Engaging the community in the solution facilitates the development of an informed, trusting, and cooperative community who is ready to help you advance your program goals. Rumour tracking works and should be a part of programming. Rumour tracking is a system to identify, track, and address misinformation, as well as monitor how well the tracking system and the program are working to counter misinformation. Rumour tracking does not have to be a sophisticated system. It can be simple or digitalized, or just simply captured in an Excel operating platform. However, one does need a specialized team of influencers, content experts, program staff, and health authorities to help with rumour tracking. It involves rumour tracking logs, classifying rumors by source, by content, who it targets, how it is channeled and spread, and the location where it is spreading. It also includes classifying the potential threat from the misinformation. Does it cause harm? Does it increase risk? Does it hinder access to service? Does it cause conflict? Does it increase stigma? Things like that. So it includes a subjective interpretation of how that rumor might impact that community. And that's best done by engaging community members. So the next few slides show how you can capture rumors in a database. On the left is an example of a rumor tracking log. On the top, you have demographics. Then you have some information about how the rumor was, or the message or misinformation was received. And at the bottom, you have the actual content of the misinformation, the specific misinformation. To the right, you have an example of data entry for classifying misinformation by themes, things like access to resources, beliefs about susceptibility, denials, fear-mongering, conspiracy theories. You just have to create a thematic response option that captures the actual effect of the misinformation in your community. This slide shows how you can digitalize your misinformation. This is from a DHIS2 dashboard from one of our projects in South Africa. And on the left, we just have real-time data on the volume of rumors that are being submitted to the platform. And on the right, you have disaggregates of rumor submissions by province. So you can look at where in your program area there's more information relative to other areas where you might be having a problem with community buy-in. This slide is a visualization of misinformation by thematic area or by topic. So it is apparent from this that misinformation about treatment, about government response, about prevention, conspiracy, and access to resources are more prevalent types of misinformation. Gives you some idea of the kind of information that the community is either lacking or not understanding. And you can track on a smaller scale. It doesn't have to be as wide a scale or as large as this one. This shows how misinformation can be disaggregated. On the left, you have misinformation and rumors disaggregated by the submitting source. And you can see that by far, community informants are a good way to capture rumors in your community. On the right, you can drill down by type of rumor and see how a specific type of misinformation or rumor is spread in your community area. We have conspiracy theories taken out of all the kinds of rumors and shown how they are prevalent in the different program areas. So all in all, a multi-pronged approach is the best way to tackle misinformation and rumors in a community. Multiple actors, multiple channels, and one consistent message. It is key that all groups say the same thing about the same issue. Identify relevant program stakeholders to assist with managing misinformation. When misinformation plagues a program, it is more effective to have all stakeholders and partners come together to address the program. It is very rarely in the domain of the program officers or those who are actually implementing the program. All stakeholders have to be brought to bear. Rumors travel in and out of project areas, so to speak. So one may have to identify and engage partners from outside of the community. For example, local government, sometimes you have to go a level higher than the community. District health is always a great endorser. Radio stations and mass media can help. Leaders of influence groups like religion, youth, women, content experts. Depending on your misinformation, you may need content experts to provide facts, credible facts, or experts from a source that you know would be accepted by the community. And of course, your program staff. An open and transparent approach is essential. For instance, if misinformation is due to a particular approach, it usually works better to admit the mistake than to be defensive. Rumors propagate through multiple channels, and one must use multiple channels to share corrected information. Dialogue is always an important approach because there is a lot of emotion linked to misinformation. There's fear, there's anxiety, there's anger, there's mistrust, all of which needs to be addressed. So it's not simply disseminating corrected information, but also allowing community members to share how they feel about what they heard or what they perceive. In addition, one can develop and share corrected narratives, and these are best done with the community. Community voices are great amplifiers. They can be trained to counter misinformation and relay correct information within the community. And of course, monitoring the response to new narratives is needed, and that can be done through your digital dashboard or through informal discussions with community members. So from the beginning, identifying rumors, to the end, measuring the response of your interventions to counter misinformation must involve your community. This last slide has some links to a few resources that you can use to help develop either a misinformation management campaign or also to develop a platform for managing misinformation for your program. Most of the principles discussed in this session came from these resources. For group 3, we will be discussing how to ensure success of mitigation strategies against misinformation in the community, focusing on 3 questions, focusing on research and programs related to these 3 questions: how we can verify effective communication on NTDs and related health services, ways to ensure sustainable transfer and acceptance of health information, and how programs can ensure the resilience of an informed community in the face of misinformation. I look forward to a productive discussion with some of you. Thank you.